don't worry, as it happens to men more often than you think. Erectile dysfunction is a medical condition in which the man is unable to have an erection or sustain the erection long enough to complete sexual intercourse. Erectile dysfunction can have a lot of psychological impact on one's own mental well-being and can affect one's sex life too. I'm Dr. Shilpa, a fertility consultant, and in this video, I'm going to be discussing about erectile dysfunction in 4 different parts. Talking about incidence of erectile dysfunction, is it a common medical condition or an uncommon one? Well, what studies quote is that till the age of around 40 years, the incidence of erectile dysfunction is close to 40%, and by the age the man reaches to around 70 years, the incidence of erectile dysfunction goes as high as 70%. What this means is that as age advances, there is definitely going to be an increased incidence of erectile dysfunction. So talking about symptoms of erectile dysfunction, the man can have a problem having an erection. Second, the man can have an erection, but he may be having a problem sustaining the erection for sexual intercourse. Third, the man can also have a problem with low sex drive. So now let's talk about the causes of erectile dysfunction. Most commonly, someone who is anxious, stressed, or has had a long day at work can have erectile dysfunction. That's totally normal and temporary. So now we are going to be talking about the causes of erectile dysfunction for someone in whom the condition has been persistent. Needless to say, lifestyle factors have a great impact on erectile dysfunction. A person who smokes a lot, consumes alcohol very frequently, there can be a drastic impact and the man can be suffering from erectile dysfunction. Well, certain medical conditions like uncontrolled diabetes or hypertension can also have a bearing on erectile dysfunction. When you visit a doctor, he may be reviewing your medication history because there may be men suffering from anxiety or depression and taking pills for that. Certain BP medications can also be causing erectile dysfunction.